exceeded his expectations. Joining us now, Democratic Congressman Elijah Cummings. He's from Maryland, the ranking member of the House Oversight Committee. Congressman, thanks for joining us.
Well, good to be with you.
All right, so let me get your reaction. What were your expectations? How did the Congressional Budget Office report do?
The CBO report was exactly pretty much what I expected it to be. 14 million people losing their insurance next year, and then another the total 24 million by 2026. That didn't surprise me. The thing that does bother me, though, Wolf, is how the Republicans are playing with these numbers. And I want, my message to them would be to be honest with the American people. They claimed that they were going to repeal and replace. President Trump talked about lowering the cost of insurance and having better insurance, and everybody would be insured and nobody would be harmed. And this proposal does just the opposite. And again, Wolf, when you're dealing with a person's health insurance, you can't get too much more personal than that. And I'm just hoping that they will be honest with the American people, lay out exactly what this proposal does. And I think that it will be soundly rejected in the House. I believe that this proposal will also be soundly rejected in the Senate because it does not bring coverage and care to the American people.
In the House, as you know, a lot of the opposition, certainly the Democrats are all opposed, but you guys are in the minority. The opposition comes from conservative Republicans. We just heard from one of them, Congressman Garrett, who says he can't vote for this because it goes too far. Some have called it Obamacare light. The CBO says 24 million Americans, as you know, will lose their coverage over the next 10 years. But the arguments from the Republicans is many of those people, they'll no longer be forced to buy health insurance, and that's their right as Americans. They don't want to buy health insurance. They don't have to buy health insurance. What do you say to that argument?
Well, anybody who knows anything about this issue knows that in the end, Wolf, we're all going to pay. And this is a moral issue. People have, I believe, a right to health insurance. They have a right to stay alive. They have a right to be able to live a healthy life. And it is getting down to a moral issue. And when I look at the proposal that has been presented by the Republicans, what I see is I hear all this hocus pocus language that they talk about. Well, you're not going to be able, we're worried about costs, but then they don't seem like they're that much worried about coverage. And so what I'm saying to them is that the American people need coverage and they need access to health care. And so but I'm begging them not to play games with this because again, it's very personal. And so what we have to do, Wolf, is follow the money. We've got a situation here where they're giving a major tax cut to folks to the tune of $600 billion, our more wealthier folks in our country. But at the same time, slashing something like Medicaid. Right. And Medicaid, of course, helps some of our most vulnerable citizens. And so, again, if we're honest about it, at some point, we're going to pay. Somebody's going to pay. So we might as well they should come up with a proposal or basically fix, if they want to fix the Affordable Care Act, they need to do that. But I hope that President Trump will not run around talking about a proposal that really takes away from people's opportunity to stay well and to be well.
The Secretary of Health and Human Services, Tom Price, says, I firmly believe that nobody will be worse off financially in the process that we are going through. Your reaction to that?
I have listened to just about every interview that Secretary Price has made, and I have not heard him say that there will not be a lot of people losing their coverage. Now, they tried to attack the CBO, which I thought was very unfortunate. The numbers are the numbers. But Wolf, there's another thing here. I think people forget that when they look at these numbers, they forget there's somebody watching us right now, Wolf, right now, who's sitting in some hospital, maybe in Toledo or somewhere in our country, with chemo dripping down into their veins, trying to figure out whether or not they're going to have insurance next year, whether they're going to have insurance the year after that, and whether or not they're going to be able to survive. There's some mother worried about her child being able to be treated for opioid addiction, and knowing that Medicaid is being sliced and mental health is being sliced with regard to these proposals. That's why I'm saying, Wolf, this is a moral issue, and Republicans have got to stop this era of not always telling the whole truth and nothing but the truth. We need to take care of our own. President Trump constantly talks about getting America back to where it used to be. I don't buy that. I think that we're all moving towards a more perfect union. And that more perfect union is about taking care of each other and helping each other in times of need. All of us are the walking wounded. All of us are going to need insurance. So we might as well take this moment that we have and create the best opportunity that we can using the American people's tax dollars in a wise, effective, and efficient way so that we can stay well. You cannot have a strong country when you've got so many people being sick and not being able to get health care.
Congressman Elijah Cummings of Maryland, thanks for joining us.
Thank you, Wolf.